for Leoclubtv, this is Leo calling. I'm with Dr. Fenton Ferguson, Minister of Health. Welcome to Leoclubtv, Doctor. It's a pleasure to have you.
Pleasure to be with you.
Alright, we're on location at the Caribbean Wellness Day, and we're going to ask you to tell us about what exactly is Caribbean Wellness Day, what it's all about, and how it got started.
First of all, let me declare that I'm an honorary lion of Portmore Club. Yes, for a long time I did clinics for Lions Club of Portmore and Fenton. Actually, Caribbean Wellness Day came out of a high-level discussion between the Prime Ministers of the Caribbean back in 2007 as it relates to the non-communicable diseases. We're talking about the diabetes, the high blood pressure, the cancer, the mental illness, the cardiac diseases, etc. And out of those discussions, it was put on in the declaration that we should have and celebrate a Caribbean Wellness Day on the second Saturday of September each year. And it started actually in 2008 until the present time. It is a day to really highlight the importance of our health in relation to the diabetes and all these other non-communicable diseases. It also speaks to the risk factors, persons who smoke, persons who are involved in excessive alcohol intake, lack of physical exercise, and also not really paying attention to your nutrition. Those are some of the critical things. Rest is also a factor, and stress in relation to these disease processes. Therefore, it is a day when we come together as you have seen, different types of stakeholders in health and otherwise, because wellness must not only be physical, but spiritual and mental. And therefore you would see a number of activities, and you might wonder how does that connect with health. But mental health is important in how we survive going forward. Sometimes the mental health problems develop secondary to a cancer case or a person who has high blood pressure that is uncontrolled, and therefore that in itself creates its own problem. But today is a good day, and I'm very happy to see the Leoclub out, because in truth and in fact one of the target groups that we want is the young people. The question of obesity in young people is also a big factor in these diseases later on in life, and even early in life. I spoke about the tobacco legislation. Right now, 6 million persons are dying annually because of cigarette smoking. 600,000 persons are dying, not because they smoke, but because they are in the presence of smokers or being in places where persons smoke, passive smokers. Yes. And therefore, a tobacco control legislation is now being contemplated by the government that will ban smoking in public space. We're not talking about in your house, but we say when you're going to a club, when you're going to restaurants, into bus, public transport, and so on. We expect that persons will refrain from smoking. And you would have seen the benefit already in areas where there's no smoking. Sure. Persons with respiratory problems, asthmatics, are seriously affected when exposed to smoking. And sometimes we have persons who are just inconsiderate, who don't believe that because you have a right to smoke, that there's a person who also have a right not to renew your smoke. So it is a right issue that we have to be looking at across the board in a balanced way. My position is not just an anti-smoking where we are coming out, because we recognize that the cigarette industry is part of a big trade. But when we look discussing this government of Jamaica $170 million annually to treat non-communicable diseases. Those same ones I talked about earlier. And so if you look at that versus what you get in as tax from the tobacco industry, the evidence is overwhelming. So I am calling on the young people, I'm calling on the VOIs, I'm calling on the Lions Club and all the other service clubs to join me in that crusade. So bring to the table a tobacco control act. And I beg of persons, I know you have your own personal interest, but I believe that national interest at all times must go beyond, above and beyond.
Thank you, Dr. Ferguson. That was extensive, and thank you very much. And we appreciate all the hard work that you are doing in your ministry to ensure a healthier nation for us all. And for Leoclubtv, they're doing signing off. Thank you, Dr. Ferguson. Any last, final words?
Just to say, continue the Leo spirit. I am disappointed that the Lions Club have not been able to develop the kind of dental program as you have done with your eye program, because back in the mid-80s when I started that program in Portmore, my intention was to get it across the country and to get it as part of oral health is now a big item. In fact, where you have oral health problems, it compromises even more the non-communicable diseases that I spoke about earlier. So it is a big item, and I'm calling on the Lions Club, the Leo Club, and the Service Club in Jamaica to see oral health as a big item as we go forward. Alright?
Thank you.